everyone. I'm Barbara Ham-Lee. So how's your summer going? Too hot to wear a mask? Just couldn't social distance at that cookout or party? Because after all, it's only family and friends. Are you simply over COVID-19? Well, here's something to think about. For every 100,000 Black Americans, 80 have died of COVID-19. Compare that to 35 deaths among every 100,000 whites. In fact, African Americans have the highest percentage of deaths than any other ethnic group. If that's not enough to make you pause, stay tuned. Cardiologist Dr. Keith Newby joins me with real talk about coronavirus. Another View is next.
Discussing today's topics from an African American perspective, this is Another View.
Hello, everyone, and welcome to Another View. I'm Barbara Ham-Lee. We're excited about having cardiologist Dr. Keith Newby join us in just a bit. But first, I want to invite you to get into some good trouble, as late Congressman John Lewis implored, by joining us for our next Race Let's Talk About It conversation. This will be a virtual conversation on Thursday, August 20th from 6:30 to 8:30 p.m. The topic is When Silence Speaks Volumes, and we will examine how we hinder improvement of race relations when we do not speak up when we see racism. Our panel includes familiar and trusted voices, Dr. Eric Claville, Dr. Cassandra Newby-Alexander, Jonathan Zur, and Veronica Galaro. Go to whro.org/talkaboutrace to register. It's free and all are welcome, and I hope you will join us. That again is on August 20th, 6:30 to 8:30 p.m. Go to whro.org/talkaboutrace and register. Okay. So here's a headline for you. The coronavirus pandemic is not over. I'm surprised? Yet many of us act like it is, and we won't wear a mask in public, wash our hands frequently, or stay away from others in public places. This disease strikes everyone, regardless of age, race, ethnicity, income. But when you talk about who's dying from the disease, African Americans top the list. According to APM Research Lab and other sources, Black Americans continue to experience the highest overall actual COVID-19 mortality rates, about 2.3 times as high as the rate for whites and Asians, who have the lowest actual rates. So why in the world would we not do everything we can to prevent catching and or spreading coronavirus? My guest has some thoughts. We are so happy to welcome back to Another View, because we miss him terribly, cardiologist Dr. Keith Newby. Hey, Dr. Newby, how you doing?
Hey. How you doing, Barbara?
I'm doing great.
I miss you.
I miss you too. Absolutely, I do. Absolutely. So, I know that you are on the front line of this whole thing, dealing with coronavirus. Why in the world would anyone, but particularly African Americans, not wear masks?
Well, I think a lot of it stems from just where information comes from. And for a lot of people, it hasn't become real for them yet. They haven't. They're starting, I think, to some degree right now. We went through this period, especially here in Hampton Roads, back in March, kind of April-ish, when the things kind of took off for a bit. Mm-hmm. And then the governor implemented his stay-at-home orders and the social distancing and the wearing the mask. It wasn't at that time really mandated, but just it was, I guess,
highly suggested.
They do that. Mm-hmm. Yeah, highly suggested. So, for a lot of people, they would hear about this, but they didn't actually see it in real time, where it was impacting them individually. Because, again, a lot of times, unless you are having communication with people who are dealing with this, you'll hear about things, but it wasn't hitting close to home just yet. So we went through this period of time when this first hit, that we saw these increased numbers back in March and April. Then kind of middle of May and starting in June, they kind of really tapered off quite a bit. So you didn't see that then. And then in July, it's like, I tell you, in the last few weeks, I've seen so many COVID patients over the last probably 2-3 weeks. It just like escalated tremendously here in Hampton Roads. That I took care, I think 14 last weekend.
Wow.
That just hit the door. And I'm a cardiologist. I'm not even an infectious disease doc, but and we could talk about why I have to be involved with a lot of those cases. But it was just now it's starting to hit home. People are starting to see it. Now there's still, until they really understand what this is all about. When you talk about something you can't see, you can't see viruses. You kind of hear everybody thinks it's like the flu, and then you get mixed messages from the government in terms of importance. You got one person saying it's a hoax and all these other things. You got another person saying it's a serious thing. There's not a unified message, so it's harder for them to really kind of understand what they should or should not do. So I think when you have all these mixed messages and it wasn't hitting close to home, there was an issue where people just weren't wearing them, and some people just think they're invincible.
Well,
I get a lot of that.
Yeah, and the thing though, when you think about the fact that a lot of the first line workers, retail workers, healthcare workers, and so forth are people of color or African American, that you would think that they might be a little bit more, because we didn't get a chance to necessarily stay home. Some of those jobs required that we were out even when the lockdown was happening, that there would be more of a sensitivity to why this is so critical.
Well, unfortunately, so I think a lot of people really and sometimes, and we could be notorious for this, where we say if it's not affecting us, it's not in existence, personally, and it you kind of deal with that a bit, just like hypertension. People have high blood pressure, but they feel okay. Mm-hmm. So therefore, I don't need to take this medicine. I don't need to change my diet. I don't need to change my lifestyle because I feel okay. And there's a lot of that, and then there's, of course, issues of distrust of the healthcare system, and there's a lot of variables that fall into play. But I am here to tell you on a first-hand basis, this is what I want to make sure people really get a gist of this, and we can, of course, keep talking about this as we go along. Sure. But the important thing I'm trying to get people to understand is, A, this is not a hoax. I want to make sure I emphasize that 8 million ways from Sunday. Mm-hmm. This is not a hoax. This is real. I have personally had people die from this at Norfolk General and other places that I've had to work. Mm-hmm. That is not an issue of anything else other than what this virus does. There are, yes, it is true that if you look number-wise at the number of people dying versus the number of people contracting the virus, there definitely is a very disparity. The death rate on is 1%, the 1% to 2%. So it sounds low, so people say, "Oh, I don't have to worry about it." But understand this: if you really think about it from a brass tack standpoint, it's not just whether or not you die from this or not, but think about the healthcare cost of you having to be in the hospital. I got a lady right now across that street that's been there for over a month with this virus. Do you imagine what her hospital bill is going to be like when she's done with all this? A month in the ICU.
Wow.
This is no joke, because it's trying to get them recovered, especially the more health problems you have, the harder the recovery. The more intense is the illness, So, and even some younger people are really getting sick with this. But of course, we see the older you are, and the more health problems you have, the harder the recovery process. And that's what I really want to emphasize to people. I worry about you dying with this stuff, but I also worry about you catching it and then having to deal with the aftermath of what it entails. Think about if you're in the ICU and you can't breathe, and they're trying to avoid ventilators in these patients because of, obviously, they found that the faster you're on a ventilator, the shorter life you have. So they're really trying to keep people off ventilators. But if you really think about what it feels like to not be able to breathe, try holding your breath for a while, and see what that feels like. And then think about if you have to struggle for each breath you have, what that feels like, how scary that thought that is. And that is now your new life, and it may or may not get better. or you may get better, but you have residual that continues to play in factors. I mean, because we're seeing a lot of heart attacks with this stuff because of the thrombosis that occurs as the virus causes clot formation, and it can manifest itself as either inflammatory responses in the heart or heart attacks, increased incidence of heart failure because of deoxygenation. I mean, there's a lot of stuff with this that is just no joke. So I'm really trying to make sure people understand that piece of this all.
440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. We're talking with Dr. Keith Newby, one of our favorite guests here on Another View, and he is a cardiologist. He's also on the front lines of dealing with the coronavirus pandemic, and call us with your questions, 440-2665 or 1-800-940-2240. So you mentioned all of those heart issues that can come from not being able to breathe as a result of contracting the coronavirus. Is that how you got so involved as a cardiologist?
Well, just that plus just being, the type of person I am, a community activist. You want to know anything that's impacting my community, I want to be involved with. So that's just kind of who I am. So I had to get involved for that reason, but then the aftermath of the cardiovascular complications was, of course, the other reason why, because we're seeing so much of it initially. And you really think about it, this really just kind of popped up in that February, March timeframe where we actually knew it was a major problem. There's only been, really think about it, a few months, so there's still a lot of this stuff.
It feels like it's been here for a long time, but it really hasn't when you really look at the amount of time. Yeah,
exactly. So it's still a lot of things about this that are we're still learning about, and we're still trying to understand how a virus manifests itself. It can be variable in different people. One person. You can't hear me?
Now we can. Yeah, you're back. You went away for a minute.
Okay. Okay. Sorry about that. I don't know what happened on that one. I was just running my mouth. But
okay, go back to what you were saying.
There's certain. We're still learning how this stuff manifests itself. In terms of all the health complications that will occur. So, again, when you have people who have varied health issues, it can accentuate the problems that they currently have. So we're still learning a lot about this virus. And again, when you talk about, I'm of the mindset, I'm not trying to catch this stuff. People can mess around with this all they want to, and I see them out there. They take their time, when they're going to stores. I catch people in stores with no mask. They don't socially distance themselves. They have these events, especially our community specifically. And I can tell you a quick story about a very tragic situation that came across. But they just don't see the. People are used to going on with their lives. They're used to doing things a certain way, having family events. And we're notorious for family reunions.
Yes, especially this time
big
of year.
Weddings. Yeah, so you have, and when you tell somebody, you go cookouts, barbecues, you tell people, you're not supposed to do this, and it's, for them, it's the reality is it's not real enough for them to understand that piece. And they say, this is family, we'll be all right.
Right.
I'll tell you this quick story. I had a lady across the street that came in, elderly lady, over 80, and I'm going to be careful because of HIPAA issues, but over 80. They came into the hospital this was back in that March, April timeframe, so we were still kind of learning this stuff. But it was in April, like late April, because the governor had already said, social distancing, put in the mandates of things that we were supposed to do and not do. So fast forward, this lady came in. This patient I've been taking care of for 20 years almost. I don't want to tell my age, so let me come back on that one. I've been taking care of for a while. I'll say that. So anyway, so she came in the hospital, had pneumonia. We were treating it, and we're still learning about this stuff. So we really didn't. COVID wasn't a high thought in our mind initially.
Mm-hmm.
But when we were trying to treat this pneumonia, she wasn't getting better. Oxygen levels kept dropping, and she just wasn't getting better. So she was in the hospital for about a week and just not getting any better. So we finally said, listen, we may need to start looking for other things, and that's when we started hearing about these COVID pneumonias and what have you. So it went ahead and said, let's go ahead and test her.
Mm-hmm.
Ended up she was positive. So she in the ICU steadily. Now her organs are starting to fail, kidney failure, liver failure, all this other stuff going on. So here comes a family member. Oh, yeah, when we told the family member she was COVID positive and not doing well, oh, yeah, I meant to tell you, we had a family get-together because it was her birthday recently, a couple weeks ago. So we had a family get-together for that, and it was like, and 3 of the family members turned out COVID positive. And I'm like, okay. There was like, by the way, I meant to tell you this. And it was, and she lasted 2 more days and died. So for her birthday, happy birthday.
Yeah.
Essentially. And that was, and it broke my heart because I had been dealing with this patient for years. I mean, that was like my buddy.
Yeah.
And and just to see that is what I call a senseless death, because it could have been avoided had they just number one not had the event.
Yeah, exactly.
Yeah, not
exactly.
even because they weren't even supposed to have the event. It was already mandated. We weren't supposed to be doing that type of stuff, but they had to have, because she was turning 80 something. Mm-hmm. So they had to have the event, and this is what came out of it. I mean, I was mad and hurt at the same time.
Yeah, and just think about the mental toll also on the person who actually was positive. I mean, they got to live with that fact that they passed on this virus when it wasn't necessary to do that.
That's the part but that's the reason why I think sometimes people get upset with us as healthcare workers because they feel like we come down on them so hard. But when you see an issue that's preventable, it's just like one of the most frustrating things for me as a heart specialist is you tell a patient, okay, I need you to follow these rules for me because I'm trying to keep you alive. Mm-hmm. So please just do this. And this is the reason why. And anybody that knows me know I don't just tell them, do this. I tell them why I'm making this suggestion. I give them the physiology, the whole 9 yards. So when you have somebody like that and you give them this advice and then they say, essentially, screw you, I'm not going to do it, in the end, and then you see them die or go to a different place that they could have avoided had they just followed these simple guidelines. Mm-hmm. This is kind of like that. It breaks your heart because it could be, they're preventable deaths, they're preventable situations. Then you got patients, I got some really sick people with COVID that don't need COVID, because they just would stay home.
Sick, yeah.
I mean, they're already sick with a bunch of heart issues. And then on top of that, then they go out and do something, and then the famous, and I almost want to pop them when I ask them, well, how'd you get this? I don't know. What do you mean you don't know? I mean, you if you were following the guidelines, you should not have gotten this. Now, granted, I'm kind of a little bit joking with you on that part. Some people really, they don't know, because you don't always know if you have a wife or, somebody that lives with you that you think was following the rules and they didn't. I mean, some things you can't help. I mean, it really is. But if everybody is on the same page, meaning that if you're a married couple, that the husband and the wife understand their part and how what they may bring home may affect this other person, and they follow those rules, that is where that's the part that gets a little missed at times. Somebody goes out, I didn't think it was any big deal to go to this place or to take this mask off.
Keith, that's also a concern of parents as we start looking at the school year starting to, and whether or not people will be going back to school in person or online. Now, we know that all of the major cities in our area, I believe I'm correct in this, are starting virtually as opposed to sending kids back into school because of the spike throughout the Hampton Roads area. But it is really a concern, because if your child is out there and they happen to contract it, and they come home, that's yet another layer that you have to deal with.
Trust me,
Before you comment on that, I want to play a clip. Lisa talked recently with Senator Tim Kaine about the toll that COVID-19 is taking on the educational system. Let's take a listen to that.
That depends a little bit on the track of the virus. And sadly, in Virginia, after tracking downward for some time, we see Virginia tracking back upward, largely driven by statistics in the Hampton Roads area. So it is a really challenging time. And frankly, we're not going to be able to get our arms around either the school piece of it or the economic piece until we do a better job of fighting the virus. That's the other part of this bill that we're working on is, what can we do in terms of more testing, accelerating vaccine development, accelerating treatments. The U.S., sadly, in my view, has done a very, very poor job in dealing with the virus. There's no reason that the United States should be number one in the world in death toll and number one in the world or close to it in the number of cases.
And Senator Kaine said that he's hopeful that a bill that they're currently working on in Washington will put more resources into testing, treatment, and contact tracing. But until we get a hold of the virus, questions about schools and jobs are going to continue to be tough. What are you saying? I know you're working with Norfolk State. I know you're working with other schools in terms of helping them to figure this out. What's your feeling about that?
Yeah, they're right with this because this is the issue. So everybody's clear with the testing part, why that's important. If you look at what's happening now, if you go to a place to get a test done, by definition, you want to know that test within 24 hours. You'd like to. Sooner the better. But if it takes a week or more to get your test results back, you're still out there. Even though you may be self-quarantining, some are, some aren't.
Right.
So you don't know till 2 weeks later because to do a contact trace, you want to know immediately who that person has been around once you know they're positive. Mm-hmm. The problem is if it takes you 2 weeks to know they were positive, and then you got to go back and try to remember who you were around, that's going to be difficult. So then you run into that scenario where and then plus you think about it, if the time it takes you to find out your test results, even if you were around somebody, short of just saying to them, listen, I'm being tested currently. I don't know if it's going to be positive or negative, but I just wanted to let you know that really pretty much doesn't happen. Yeah. So they turn up positive. They tell you, but that's 2 weeks ago that they were exposed. So now they've been out affecting everybody else if they turn up positive, because they may or may not have any symptoms associated. So the delay in testing creates the problem. Well, because if you test and know immediately, or 15 minutes later, or 30 minutes later, whatever, then you can jump on that and say, okay, I'm quarantining. I can then tell 5 other people who I know I was around recently that, listen, I tested positive. Make sure you get yourself tested and you need to self-quarantine. That can halt it faster if you get that information quicker.
Well, and Governor Northam talked about yesterday about this new using an app to help with that tracing. Well, they say it's not tracing, actually. It's just to let you know whether or not you've been close to someone who has tested positive, so that you can start your quarantine earlier, is supposed to be the point of that. But before we talk about that, let me do this real quick. If you're just joining us, we're talking about African Americans and coronavirus with cardiologist Dr. Keith Newby. So what is your thought on, have you heard about this new app? It's called
I have.
COVIDwise.org.
Yeah, I have. I don't know all the details of it, but I've spoken with the governor a few times, and we text message each other a bit at times. So I know kind of some of the nuances of what has been going on. The keyest thing is you got to get on the app. B, you got to make sure your information is accurate and in there. So I don't know all the nuances of it. I just started reading on a little bit this morning. I saw the article in the paper. But if it can be kept up,
well,
it has a lot
but the other thing, Keith, too, is the whole idea of, again, here's another area where trust is critical if it's going to work. And we know that particularly in our community, the trust of systems is not there. So, I mean, do we really think that people are going to, jump on and participate?
I know. And I know I'm not laughing at the situation. It's just the realities are. I'm laughing because unfortunately, that distrust of the system. So you put some information in there. Who's going to see this information?
Right.
And I'm not putting that in there because I got folks right now. I have family members that didn't even want to put money in a bank because they didn't trust the bank. They hide it in the backyard, buried under some rocks, which again may or may not have been the right thing to do. But the realities are, when you look back at the healthcare system in general, it really has not been favors to African Americans as a whole. You think about Tuskegee and other things that have transpired. It's really fully understandable why there is a mistrust. I tried myself, and my older brother is a physician, and some other folks in the community. I said, our job, and I think we all see our role, is to be that advocate, that they know that they can trust what we say, and that's why I do so much time, spend so much time with patients trying to explain why we do what we do, so they kind of get that sense that we are trying to help. But that mistrust is going to be an issue, and that's partly why. And access. I mean, think about this stuff. Will you hear about this app? For those who need to know it and who are at highest risk, how do we get information to that group of people? Everybody doesn't read the paper. Everybody doesn't have access to the newspaper.
No, you're right. I mean, the whole point is about making sure that we get into these communities. I want to play a clip from some African-American pastors and community leaders about testing, because this was a video that the city of Norfolk put together. But again, trying to make sure that the right people who need to hear the message hear it. Let's take a listen.
Hi, I'm William Tyree, the pastor of First Baptist Church, Berkeley, here in the city of Norfolk.
I'm Joe Dillard, the president of the Norfolk Branch NAACP.
I'm Gil Bland. I'm president of the Urban League of Hampton Roads.
I'm Pastor Keith Jones of the Shiloh Baptist Church.
My name is Kirk Houston, the senior pastor of Gethsemane Community Fellowship Baptist Church.
Hi, my name is Donzel Jones Sr. I'm the pastor of First Pentecostal United Holy Church.
Calvin Durham. I'm from New Hope Church of God in Christ.
Hi, I'm Glenn Porter, pastor of Queen Street Baptist Church in Norfolk. As we all know, the COVID-19 virus has caused many concerns.
It impacted our lives in many, many ways.
In addition to sickness and the deaths caused by the virus,
we've been frightened by rumors and misinformation about the testing.
I want to assure you that the tests are safe and highly recommended,
especially for those who have the symptoms or have been exposed to others with the virus. I'm going to take the test today, and I recommend that you do the same if you have the symptoms and if you're given the opportunity.
It's just like a swab, a thin Q-tip. There's nothing to it.
Remember to practice social distancing.
Wear your mask, wash your hands,
and help your family and community remain safe. God's peace, favor, and blessings to you.
Now, I know many of the African-American churches have medical or health ministries. I know that you're a part of it at First Baptist, the historic First Baptist Butte Street. And do you think that is the another way for the word to get out to our community?
Yeah, I think one thing I've found is repetition is what's needed. The downside to this time frame is, whereas once before, of course, before the pandemic hit, I was in church almost just about every Sunday.
Right.
I mean, with rare exception. Unless I was on call that weekend. Now we don't have that interaction.
Right.
That physical.
Everybody's doing virtual.
Where we're there. Exactly. And although you can get up there and watch, there's nothing like when you're physically there and you have that interaction to get a word out. So it's a little tougher now to get that kind of constant reminder that this needs to take place. So whereas before we would all be there and the pastor would get up and say something. A lot of times myself or some other member of the church would get up and speak and emphasize the importance of this. And you can still do it through social media, but you have to, it's nothing like that personal interaction that we really don't have right now to try to emphasize some of this. So that is somewhat of a dilemma of getting this word out. But the biggest thing, to be honest with you, is just the access itself. If I say, I had times, I had a attorney friend of mine that called me last week and said, listen, my kid may have been exposed. I need to get a test. Where can I go? Right. And I got to think about it. Yeah. I mean, you have to think about it, to say, where do I send this person? Because when I'm sending them and they're telling me it's taking 16 days or longer sometimes to get a test result back, that's where you run into this problem, is access and then time it takes.
Yeah, and then when you have communities that where people depend on public transportation or walking or whatever, and unless churches or other groups bring testing to that community, it's very difficult for them to travel to get a test.
We're looking now trying to get the equipment to do our own testing at Fort Norfolk, and the issue that I'm running into is, the analyzer. I mean, this thing is expensive, to do it, and they guarantee. They say if you do it, it's a PCR test, which is, very good. It's looking for the RNA molecule, so it's accurate, and it can give you the results quick. But the issue comes is they can't guarantee me how many test kits I can get. So it's like, and I told the company, I said, hold up, Chief. I said, so you're asking me to spend,
X amount of dollars,
a ton of money. So we're talking over, I'll just say over $20,000 to get the analyzer, but yet you can't. So suppose you can only give me 2 kits a month. So I'm gonna spend, greater than $20,000 for 2 tests. And I'm not saying it's that bad, but they just could not guarantee that they could keep up with the demand. So that's the issue. And when you talk about doing tests locally, because I think a lot of us will get to the point where we're going to have to start doing that. Can't just all depend on the hospital system or, the urgent cares out here. I mean, because, but we're all going to have to take part to some degree, but we have to be able to do it, what makes sense. I mean, at the same time. But I think that's where a lot of us are starting to look into is, can we start doing our own testing? I know I've heard there's some other tests coming out, the spit in the cup thing and some other ones that are out there. I just don't know their accuracy just yet, because I just started hearing about some of those. Actually, I think my wife told me that there was one she read that was going to be a home one. You could do it at home. I don't know anything about that. She just mentioned that to me yesterday. But I know there are, they're still trying to come out with, further tests, and they could give more expedient results. But that's really going to be the key, is can you get a result fast enough so you can implement whatever change you're going to make and let those people around know. Because, again, you don't want to necessarily, scare people because you think you may have been exposed, and then you have a negative test, and then you got everybody else all scared to death because they're thinking they're going to catch this stuff and something's going to happen to them, unless you really know that you were positive. Yeah. So it's just that's why I tell people all the time, if nothing else, I tell people, if you don't listen to another word I say, act like everybody around you has it. That is like the safest, to me, approach, is assume everybody has it. Because then you'll always do what's necessary to be protective of both yourself and your family. Because you really think about, like you say, the guilt that you find out that say you were asymptomatic carrier and you gave it to some loved one and they died from it. How would you feel? How would you handle the psychological ramifications of knowing that you impacted somebody else's life? That's why I tell the people that want to be selfish about this and start getting into debates about the point of wearing a mask. I said, listen, my constitutional right. I hear that one more freaking time about somebody's constitutional right not to do something. I'm like, I got a constitutional right to live. And what you're doing may impact me. So no offense if I'm not so worried about your constitutional right not to wear it. I'm worried about the aftermath of what happens if you don't.
Absolutely.
And not just for me, but those people around.
Exactly. 440-2665 or 1-800-940-2240. Are you wearing a mask? Are you following social distancing and washing your hands? Are you just saying, you know what, I'm going to live my life. I'm going to the parties. I'm going to go hang out. We want to hear from you. Give us a call, 440-2665 or 1-800-940-2240. Heather joins us from Virginia Beach. Hi, Heather. You're on the air.
Yes, I'm doing all of those three things, and I'm trying, not with kindness, with real determination. Stay 6 feet at least away from me, because if you don't have on a mask, or even if you do, as soon as you speak, those virus germs are in a fog around you, and they need to hit the ground, not fall on me. I'm calling to thank the good doctor for bringing up how expensive this is going to be. Not only heartbreaking if we lose people, but when people survive, those medical bills will come due. I don't care how good your insurance is. So many people. So if anything will deter you and say, yes, every person, unless you know exactly where they have been every moment, you have to treat them as a possible carrier and protect your investments and your money, because financially you will be drained. So if that can be the only deterrent, rather than being, oh, I'm liberated, I'm an independent, nobody tells me what to do. Excuse me, you better stop at that red light if you want to make it safely through that intersection.
Got you, Heather. Thanks so much for the call. We appreciate it. Go ahead, Keith. You can respond.
She's all right with me.
Yes.
Heather's all right with me.
Yeah,
but her points are extremely valid.
Absolutely. We had someone on named John, and apparently, I don't know if something's going on with our phones, but he wanted to know, Keith, that if you were in charge of the medical system in the United States, what would you say to people about wearing masks? What's the push, or the, how would you get people to really get involved in wearing their masks?
I think it would just be the focusing on the, how wearing a mask or not wearing one impacts those around you. I tend to try to focus on people's sense of sensibility and, the love of their loved ones, because, again, and you have to show factual data. I mean, a lot of this stuff, it's become too political. This is a health issue, not a political issue, but they've turned it into a political issue, unfortunately. So that's where the disarray comes in. But one unified message, everybody on board. This is what needs to take place. Everybody's, even if you don't necessarily agree in theory, but the science is there. To me, it would be that you talk about why it's important, how this is impacting other people. You start giving examples of that, and really focusing on that piece of it all. I always say you got to hit people in their sensibilities section to get them to see why. And some people, no matter what you say or do, they're going to do what they're going to do.
Anyway.
I mean, they're going to do it anyway. But if you can reduce the number of people feeling that way, that would be the way I would approach it.
Okay, let's go to Lyle in Virginia Beach. Hi, Lyle. You're on the air.
Oh. I heard the doctor talking about the app, and he said he hadn't installed it or used it yet. I installed it this morning, and it's very simple. You don't have to put any information in. It doesn't collect any of your information, so without any of your information, it can't pass it on. But the way it works is it gives you it doesn't give you, it makes a code that's good for like 10 to 20 minutes. And when you're around somebody, it detects them on Bluetooth, somebody that has the app also, and it'll exchange code. It'll say, I'm whatever number, and they'll say, oh, I'm this number. And it keeps those codes for 14 days. And then if somebody puts into the app that I tested positive, it will add all the numbers all the codes they've used in the last 14 days to their list of people that have tested positive. And the apps every morning go out and download the latest copy of this list of people that have tested, or list of codes that have tested positive. And then your app looks and sees if you've been near any of these codes. in the last 14 days. And if you have, it notifies you that you've come into contact with somebody. And the only information it keeps on those is the code and the duration. So it might, know that you were around somebody for 10 minutes or 2 minutes or whatever, but it has no idea who it was, where it was, excuse me. Didn't know who or where it was, just when it was and for how long.
Lyle, let me ask you a question, though. If you were to test positive, it sounds like you're a very responsible person. If you were to test positive, you have to go back in and report that information in order for them to know, right?
Yeah, there's three buttons at the bottom. One is for, saying to turn on notifications and allow it to use your Bluetooth and so forth. One is to say you tested positive, and the other one is just to get more information.
Okay.
It does have a link to the state website about COVID-19.
So people will have to be honest and report in order for it to work. Thanks so much for the call, Lyle. We appreciate it. I mean, it's simple to install. It takes a bit of responsibility on people to report that they actually have tested positive. But if this is yet another tool to keep us safer and to get tested more quickly, Keith, you think it's a good idea?
Yeah.
Yeah.
Oh, yeah. I mean, if you're not, the only thing is I know people are going to say, well, somebody's going to have access to whoever codes what, because they got to track that stuff. So, I mean, I think you'll run into somebody who may say, well, even though I may not be inputting my personal information, you get the conspiracy theorist people out here that'll say, well, somebody's going to see this information in the government and blah, 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 and they come up with all these, issues they're going to have with it. But when you really think of brass taxes, I mean, we have to get past that kind of stuff, because it's just like, to me, somebody says like this, and I'm going to tell you, when I hear folks, and I have patients that say to me, they're trying to convince me that all this is just a hoax. And I'm like, well, for this to be that much, this great elaborate hoax, I said, help me understand when I'm seeing people dying across the street, where are they dying from? Because I mean, you're just like I'm seeing it firsthand. I mean, unless you tell me something different, I said, why? I mean, I don't think any election is worth doing all this for. I mean, where you talk about to get every health person and everybody on board to say this is fake. That's just, ain't no way.
You're seeing it firsthand. Absolutely.
Firsthand.
We've got 5 minutes left, so let me try to get one more call in. Let's talk to Pam in Virginia Beach. Hi, Pam. You're on the air.
Hi there. Thank you for taking the call. My question has to do with the pneumonia shot that is given to senior citizens, and why hasn't there been a greater promotion of it, as in it might lessen the severity of the pneumonia that seems to be a part of the coronavirus? And I'll take my answer on the air.
Okay. Thank you so much, Pam, for the call. Keith?
Yeah, different pneumonias. Usually pneumonia shot is more for bacterial pneumonia. This is a viral pneumonia, so it's a little different, in terms of the cause.
Okay.
So, but the thing is, to me, I tell people all the time, like the flu shot and, the pneumonia shot, you want to stay abreast and on board with things like that, because what you don't want is to get the flu and coronavirus.
Yeah, absolutely.
Because you can get both. So you want to be on top. It will help with a bacterial pneumonia, the pneumonia shot, but it won't help with a viral pneumonia. So that's the reason why, just to answer her question.
Okay.
But you want to stay on top of it so you don't get a mix of pneumonias, because a viral pneumonia can turn bacterial. And vice versa, because when you get sick like that, then you become susceptible to other infections. And you don't want to drop your immune system to a point where you start getting other things. So if you have an immune response already developed for like the flu and for pneumonias, it will help to potentially lessen the complication rates of coronavirus.
All right, I'm going to try to get one more call in. We got 3 minutes left. Andrea from Williamsburg. Hi, you're on the air.
Hi, thanks for taking the call. I heard on the news this morning that Mayor Garcetti in Los Angeles is going to have the water and the power shut off to these homes that are having these big parties. I don't know the details. They mentioned something about short-term rentals and some places that are are vacant and people are going in, but of course private homes could, and they've shown some of them on, when helicopter or whatever flies over.
So you want to know whether or not this might work here in this area?
Yeah, I'm saying, hey, why not? Let's try it. I mean, neighbors can call in and say, there are a ton of cars parked out of this house, in front of this home, blocking the streets, and they're obviously partying.
Okay, Sandra, we got to run because we're almost out of time. I want Dr. Newby to have time to answer. Thanks for the call. Go ahead, Dr. Newby.
well, the thought is a good thought, but let me tell you something. How many times you call the government to get a quick response on anything? I think about 3 days later, they come out here, that party's still going on out there.
All right, take one last minute.
All my government friends, I'm sorry. I had to throw it in there, though.
I'm going to get one last minute for you to just say again about why we should be paying attention to this. Go.
All right. So the bottom line is we have a virus that's highly contagious, highly infectious, high rate of complications. The hand washing, your hands full of germs. Bottom line. I wash my hands so many times a day, you should be getting chafed, but they're not. So far so good. But the whole point of this is what you're trying to do is lessen the potential spread of the virus by keeping those hands washed. You keep that social distancing because they have shown that depending on the type of covering you wear, shows how far those particles can go from your mouth if you cough or sneeze or whatever.
Right.
So even speaking can do this. So that's the whole point of the facial coverings is you as a person, because you don't know if you're infected or not. So if you are and you have facial covering, that's going to keep you from spreading that to other people.
Absolutely.
The N95s and things, can really help the person. That can protect the person that may end up getting it. But really the mask is designed that you're not spreading it to somebody else. Everybody complies.
We got to
go.
They
comply, the risk is less.
Absolutely. Thank you so much, Dr. Keith Newby, cardiologist, Dr. Keith Newby. Hopefully we'll have you back real soon, and we'll be right back.
Hi, this is Essie Patha-Murkerson from Law and Order. You are listening to Another View.
Well, as much as we stay home, I'm caught up on all of my favorite Law & Order shows, so there you go. It slowed her down, but didn't stop her. That's how Sharika Myers describes her childhood stutter that was the catalyst for a children's book series. Myers recently spoke to our Lisa Godley about the challenges of her youth, her work as an author, and encounters that have allowed her to grow her message.
2 years ago, Sharika Myers began her journey to help children who are teased or ridiculed because of a speech impediment. Sharika had grown up with a stutter and, as a result, had experienced firsthand the pain and suffering that a child who's being bullied faces. She decided to tell her story through the eyes of a character in a book, who she named Little Herbie.
And remember, kids, to always be mindful to other kids that stutter, because it's not nice to tease.
The real Little Herbie is me, but my grandson name is Little Herbie. And I named my mascot after him because he stuttered. But the first story is about me moving from Baltimore, Maryland to Charleston, South Carolina. And then I had to deal with meeting new people and people laughing and making fun of me because I stuttered.
She titled her first book, Herbie's New Home. The idea was to encourage children to read. She says it was reading that helped her control her stuttering. And she shares her story online.
Growing up stuttering was one of the hardest things I ever had to deal with. My mom had 5 kids, and I wonder why it had to be me.
Sharika has taken her story along with a message of anti-bullying and tools for building self-esteem, classroom to classroom, school to school, and state to state. And most of the time, by her side is a 6-foot-tall costume character with brown skin and curly black hair, wearing tennis shoes, blue jeans, and a white t-shirt, who goes by the name Little Herbie.
Well, the first reaction I got, the kids loved it. It was like, wow. But I never forget this one little boy. He was a Caucasian little boy. And, you know, after assembly is over, little Herbie goes around and shake their hand. And one little boy, he didn't want to shake his hand. He asked, you know, why did he have to be that color? And it caught me off guard because the first time I'm like, huh? And he said, why do you have to be black? I said, why does that matter? He said, because I don't want to shake his hand. And he didn't shake his hand either.
Sharika says she's even had some bookings turned down because little Herbie is African American.
He's an African American mascot. That's just what it is. I want our kids to be able to see someone that came from the same place where they came from. And, you know, I want our kids to be able to not feel as though that they have to accept that all mascots are Caucasian. But look, we have a mascot that looks like us as well.
Sharika says the negative encounters have also inspired her to grow her message and address racial equality.
Now, when I go, I always tell the kids, I say, you're little Herbie. Every last one of us is little Herbie. Just because, you know, our skin is different, that shouldn't limit you. Racism is taught to a child. Even though they're going to go back home and whatever's being taught at home, that's what they're going to learn. But while they are in my presence, they have to understand that all race matters, you know, and that they're not above the next person because they're white or because they're black. I just want them to see as equal across the board.
And she named her nonprofit, Everyone, the number one, Voice Matters. On the site, reading is the main focus.
And the word of the day is responsibility.
Throughout the summer, Myers has been offering free online tutoring in hopes of helping students in her hometown of Charleston, South Carolina, stay on track.
When the pandemic hit, most of our kids in certain areas here in Charleston, South Carolina, didn't have laptops, and most of them was missing work. You know, so I created this thing called Little Herbie Virtual School. On Mondays, I work with kids not just in South Carolina, but all over. They'll log in, and we do math work. On Wednesdays, we do STEM activities. And then on Thursdays, we have reading time with Little Herbie. And when they came out with a lot of kids missing work, I said, you know what? Most of those kids who was missing that work are our kids. Some kids haven't had a book read to them since school was out, and this was like since March or April. I said, so I want to be able to help them with that because I've been there.
For Another View, I'm Lisa Godley.
And you can learn more about Sharika Myers and Lil Herbie by logging on to lilherbie.com. That's LILHERBIE.com. There's some breaking news. Ohio Governor Mike DeWine has just tested positive for COVID-19. So once again, the things that Dr. Newby said to us are so very, very important. Thank you so much for spending time with us today. Do us all a favor and wear a mask, wash your hands, stay 6 feet apart. The more we pull together, the sooner we can stop the spread. Share this show with a friend by going to anotherviewradio.org and downloading the podcast. And check us out on Facebook or hit me up on Twitter at Barbara Ham Lee. Next week on Another View, the Another View Roundtable. If the community is talking about it, so will we. Our theme music was composed and performed by Jay Sennett. Special thanks to producer Paul Bibbo of Hearsay with Kathy Lewis fame. He's sitting in for Lisa Godley. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our phones. I'm Barbara Ham Lee. Stay safe, everyone, and let's get together again next Thursday at noon for Another View.